I'm very happy today to be joined by two people that I've worked alongside for the last 12 months in supporting their projects, and they have some fantastic examples to share with you today. Some fantastic work being done by Ben and his team within Merton, and also Caitlin and her team within Barnet also. I won't, as I say, delve on too much about each of the individuals at this stage, because at the start, what they're going to do is just give a brief summary as to themselves, introduce themselves, and also the projects that they support. So I'll let them explain that. Rory, if you just want to skip on to the next slide, we're just going to give you a quick outline as to what we hope to cover within today's session. As mentioned, what we'll do first of all is Ben and Caitlin will be able to give yourselves a bit of a background to their projects, and specifically the points or the themes that they're going to discuss is around how you can connect your community with more providers, how you can engage those providers then that are part of your programs, and then how you can then build those relationships with those providers. They'll also cover how they can then enhance your community and how you can engage with those local providers. And what we'll then discuss as well is we will look at Elementor as a solution and the solution that we provide, but also then how within Elementor you can then monitor the uptake and engagement of your provider services. And in addition to that, how you can then assess and report on that impact. From that, then we'll open it up, as we say, to the Q&A section. So any questions that have been asked within the chat box, or again, we'll open it up so that you can ask just questions that have come to mind. So Rory, if you want to skip on the next slide. And I'm going to hand you over to Ben first of all, and Ben is just going to give an introduction to himself and also the project that he works with. So Ben.
Yes, hi, good afternoon everyone. Thanks for attending. I'm sitting here in Merton, which is a London borough in southwest London. My name is Ben, I'm the head of social prescribing at Merton Connected. We are a voluntary organization. In Merton, we have started with a pilot project already in 2017. Initially, we just had one link worker, then 3, and now we have a team of 11. Merton Connected, we have recruited the team of link workers. We also manage them, but they are located within the 22 GP practices, and the funding came from the local CCG and from the PCN. So the money is from the NHS. But we, as a voluntary organization, we recruited and we manage the service. Yes, on one hand, our borough is really characterized. It's rather small borough, but it's characterized by its diversity of the residents. On the other hand, we have to deal with rampant disparity between the different parts of Merton. At the east side, you have Wimbledon, which is quite a affluent area, and then in the middle you have Morden, which is kind of in the middle, and then you have very deprived pockets in the east of the borough, in the east of the borough. So it's quite difficult sometimes to deal with such a range of challenges, but we are there for the patients and we support them, hopefully holistically. I'm going to pass over now, I think, to Caitlin, isn't it?
Yeah, fantastic. Thank you, Ben and Rory. My name is Caitlin Bays. I'm part of Age UK Barnet, which is a local Age UK charity. Barnet is north central London, so it's one of the largest boroughs in London, and the social prescribing service in Barnet actually started in November 2019, so relatively new, and it was based within the primary care networks to begin with, and it was actually managed through the Barnet Federated GP, where they brought Elementor on as their case management system pretty much from the beginning of the service rolling out. Age UK Barnet, however, came on back in May 2020, so a few months later on, where I came on to manage the service, manage the team, and also manage service developments. So Age UK Barnet then began to recruit their own social prescribers and hold the management of the existing social prescribing team, which back then was 8 social prescribers altogether. So there's 7 primary care networks in Barnet with a total of 51 GP practices. So all are engaging with social prescribing and all are actively referring into the service. All PCNs have at least one social prescriber covering their GP practices. There's a little map of Barnet there, and you can see the largest borough of the sort of pink colour. There's 15 surgeries there, and they have now 6 social prescribers. And like I said, it started with 8, and now we have a team of 18, with another 20, well, with another 3 more to join before the next financial year. If you want to go to the next slide. So really the first sort of point myself and Ben are going to cover is really just sort of how we've managed to connect our community with more providers. So as Age UK Barnet's examples, the team actually sort of set up our own, sort of hosted our own coffee breakfast meetings, which was back when we were in the lockdowns essentially, and really that was for our benefit as much as the organisations in Barnet, to keep up to date, to understand what people were changing and how they were adapting to the COVID restrictions. So we hosted 2 of those in the first year, so in 2020, and from that we actually recorded all the updates, and we started to input that into our Elementor intervention list. So we worked with our project managers from Elementor on the intervention list, updating it, and then from that we then started to build on quality approving our interventions and our other services, or the other services that were updated from additional Elementor users, to start to then build on our own directory, so the service locator function in Elementor. So that was a really sort of positive work that we did, and we're still hosting those coffee breakfast mornings to meet with regular service organisations across Barnet, and to help them keep up to date with each other as much as they update us. And then what we also do in Barnet is setting up regular networking sessions for the social prescribing team. So we have at least 2 a month where new services or services that we're having challenges with, we meet with them and sort of improve our partnered working. And that helps to engage more providers, while we can then share back what we're doing across our Elementor portal and how they can get involved. Over to you, Ben.
Yes, and similar to the efforts from Barnet, we also invite our local providers regularly for, we call it, social prescribing roundtable. We had so many organizations contacting us regularly. That's absolutely nice, to join our team meeting to increase their referrals. And what we've said, we can't really invite hundreds and hundreds of organizations to our team meetings. So we set up, we call it a local social prescribing roundtable, and then everybody who wants to meet local partners, they can join in, or to increase referrals, or to meet the whole social prescribing team. We just do it quarterly, but it works for us. It's a quite good idea, I think, for us locally. I'm not quite sure if that would apply elsewhere, but for us it works. We also are using Elementor as our internal directory. We are using Elementor now since January 2020. And before we were using the software CRM, and on that internal directory we had pre-COVID around 800 local organizations and services, so quite a lot. So Elementor is really helping not just ourselves, but our local partners to create that local internal directory, which is fantastic. Yes, we are paying the local license for Elementor, but therefore we can share the license with all of our local partners, which is very good for small and grassroots organizations who couldn't afford a license. And also what's been quite interesting for us is we are really learning a lot about existing services in neighboring boroughs. So Sutton, for example, or Croydon or Kingston. Often we have residents living in Merton, but they're still registered in the neighboring boroughs, and vice versa. And some of our neighboring boroughs, thankfully, are also using Elementor, so we wouldn't have in-depth knowledge about services provided over there, and vice versa. And that's Elementor has been a really great tool for dealing with those kinds of patients and having more local knowledge across Southwest London for us. If you can change the slide, please, Rory. Thank you.
Brilliant. And just some examples of how we've engaged providers in our programmes. So in Age UK Barnet, we've actually been looking to get providers on board for about the last 4 months now. So this is relatively new, and we've been sort of trying different things to increase engagement. But I've been at several sort of networking meetings, community events that have been hosted across Barnet. So that includes sort of voluntary sector forums, steering groups of sort of voluntary organisations, as well as sort of more project work or project groups that have been set up. And so I've sort of managed to get myself invited and essentially just present on the benefits of providers having access to this portal. So I've been able to do demos and sort of showcase just from sort of promoting that the use of having providers on board. And this really sort of a big part of that was about the service locator function. So in Barnet, there isn't actually a particular directory of services that we use. There's sort of a few around, but essentially nothing like officially installed for Barnet's use. And so that was sort of a big part of that. Promoting that Elementor, this function is free for providers. It's free for them to have access, and it's there. We've got the funding for the next 3 years, thankfully, and so it's a really exciting time for us to look at the opportunities that could bring for Barnet. So we've had the training session ran in December as the first official one, and then we've got another 2 booked in for February. And I'm not gonna lie, it's quite hard to get people to book in. The excitement's there, definitely, and like I said, I've had really good sort of feedback from providers and interest in the portal, but I think getting providers to actually engage has been a bit more challenging and actually book onto the session. So what myself and Rory have sort of put together for the February's sessions is actually offering a live engagement training from Elementor themselves, but also to offer recorded training. Some people might just prefer to do it in their own time, which is getting a lot of interest as well. So we've got these running next month, and so we're getting more people booking on, which is exciting to see. With Barnet, the opportunities for Elementor are really exciting, as we've been sort of discussing the opportunity of having the directory, which we use as our service locator, to actually be built into an interface website, which could be public facing. So basically using Elementor's provider access as a interface website for the whole Barnet public to use. So our local authority and public health are looking into whether we actually develop Elementor as its official Barnet directory, which is an exciting opportunity that we're looking into now.
Thank you, Caitlin. Yes, similar experience also for us in Merton. We have organized, I think, 3 altogether workshops for providers to join the software. Everybody was very enthusiastic when they started, but then a lot of small charities don't have the resources, the staff, or sometimes the time to get their head around the software. And I mean, to implement the software also within 20 GP practices, and then to deal with 6 clinical directors and hundreds of GPs, it really took some while and was quite frustrating initially, I have to be honest. But it was worthwhile to invest all the time, because now it really works for the team. Recently, local organizations have started as well to use the software. Our team, we really are very grateful of the great opportunities about the software, because Elementor have been quite flexible when we wanted certain changes, and there's always somebody for us to contact. So we had the right support. But I do have to say, initially, it's a bit of work, but for us, it was really worthwhile to invest that time. Rory, next slide, please. Thank you.
Yeah, definitely. I mean, a lot of these points sort of work in with each other, really. So looking at sort of building better relationships with your providers. Something we've been doing in Barnet is we've actually started a social prescribing advisory group, which is where all of our local kind of community organisations meet regularly with the Age UK Barnet social prescribing team, and we use that platform to really promote our reporting features. So we sort of feedback from the social prescribing themes, needs across the borough, as well as highlighting gaps in provision that the social prescribers are finding. And with the support of those community organisations that we partner with most closely, we then sort of discuss each area and hopefully look to find things that we can put in place, or how we can work together more efficiently to meet demands and to meet patient needs. So that's something that we've been really doing to build better relationships and actually provide back information to the community, especially as we don't have referrals from our community organisations. Our referrals just come from GP practices in Barnet. So it's nice to be able to offer this information out and really support our community services where we signpost and refer. During this time, we also hear back from them in terms of the organisation's challenges, and this may and often is due to sort of their responses from the GP practices or the primary care network teams. And so we do our best to sort of support those pathways going back in as well. So an example of that is we met with the Jewish Deaf Association, who really highlighted the challenges in lockdown of people with hearing impairments actually being able to get access to their GP practices due to translators not being offered and only telephone consultations, especially in that first lockdown. And actually we were able to put back GP bulletins to promote the Jewish Deaf awareness training sessions that they offer. And that was a really good gateway into the primary care network teams to learn more about how they can essentially just meet people's needs better. And that was a really successful sort of to and fro support that we were able to offer, and likewise from us highlighting our challenges and our gaps, they've been able to support us further as well. And essentially I've mentioned the reporting, but the reporting feature on Elementor is fantastic, and I feel like that knowledge that we get of all the different needs across the borough essentially is really important to share back. So we work really closely with public health and we work really closely with our local authority, offering those insights from our reporting, looking at potentially the main themes coming through, and actually where we're signposting and referring, because our social prescribers do log the interventions that they're utilising. And so we've been able to do reports for sort of either key funding placement opportunities, but also projects like the mental health transformation project that's happened in Barnet, and also the homelessness forum, where we've been able to offer housing reports to really sort of highlight those needs and gaps and where the funding should be placed. And that just helps to highlight as well, obviously, longer waiting lists and more demand on these organisations, and we're able to feed that back on behalf of other organisations that do not have those routes. So it's a really, really good position to be in, and the reporting allows you to do that really well. And then lastly, yeah, so essentially just connecting regularly with new services on offer, and being able to respond to the challenges of the team. So listening to where social prescribers are struggling, whether that's, you know, referral pathway breakdowns or communication breakdowns, we are then able to make sure that that's sort of targeted, and so my role as the manager is to ensure that we're working efficiently with our community groups, and so we do meet regularly with those, reporting back actually any negative feedback as well as positive, and I think that's a really important way to build better relationships going forward.
Thank you, Kate. Yes, as Caitlin has already mentioned, the software is really great to identify gaps in provision, because before we had Elementor, it was more anecdotal, and now we can really provide data in relation to gaps in provision. Also, we were lucky enough in Merton, there is a budget within our contract with the CCG and the PCN. It's a capacity building fund, because we've been running the service since 2017, and initially we have overprescribed particular services, and they came back to us and said, everything is okay with social prescribing, we're here to support you, but you are bombarding us with referrals and we do not have the capacity to deal with this. So our local CCG, they gave us money, and we can, when we identify either gaps in provision or when we over-refer to a particular service, and it's, I mean, it's a modest amount, but we have supported local organizations. And again, that has only been able because of Elementor, because we were able to underpin the reports and finding with data. So that was quite useful. And I think that's our role, to identify gaps in provision, to talk about health inequalities and all those sort of things. And the data is really perfect to do that. The other thing is, we as an organization, I mean, I'm dealing now with 5 different software systems. We have, you know, the NHS software is EMIS and Vision, then we have Elementor, we have Lamplight, and we still have CBCRM. And I'm dealing with other organizations. It's a bit all over the place sometimes. But sometimes we have to remind ourselves that it's just a good offer for smaller organizations to use the software, and again, for their report writing or funding opportunities, to have a resource of where their data is collected, especially when they don't have a lot of staff members. Once they got their head around the software could be really utilized for them to find good data for their reports or funding opportunities. Thank you, Rory.
Brilliant. So yeah, now is just really a time for us to just share just overall our experiences of Elementor. So honestly, the Elementor team and the platform has really been fantastic for Barnet. Like I said, I wasn't there at the beginning, so I can't comment on the sort of rollout of the system. But the best feature for me is really the reporting. And the sort of exciting development opportunities it has. We're looking at potentially self-referral routes, which that's ingrained in, and also that directory of services for Barnet. And I think that in itself, the fact that the system is completely bespoke to how you want to take it is a really great feature. And essentially, I don't want to put unlimited, so I put it in quotation marks, but it does feel unlimited in terms of the amount of training and support that Elementor do provide. It is really sort of a very kind of in-depth and very professional and very engaging training sessions, and the amount of support on offer is really important for me in terms of the rollout of it, because obviously we, you know, as Ben mentioned, sort of rolling out individually for 52 or 51 GP practices has definitely had its challenges, but the amount of support is fantastic for that. And as I was saying, the sort of integration of Elementor we can't comment on at the very beginning, but I will put out as well that I think it's important, while we know other managers who have Elementor, it's actually really important to lean on for good practice and what you found has worked well and what hasn't, essentially, because the integration that we've had with EMIS for the SNOMED code pushback and then potentially the NOTE code pushback has overall been really good, but it, as Ben mentions, it is frustrating because it essentially requires the GP practices to integrate those steps themselves. So getting that communication across and that engagement from them to do the integration legwork is a real challenge. And while the support is fantastic, it is something that we've really struggled with, as quite a few of the GP practices just haven't engaged fully with that. So we're still working on best ways of managing that. But essentially the main feature that Barnet really love about it is that it does talk to EMIS, and that does make that a much smoother process for the referrals, and for social prescribers to communicate referrals outcomes back, which is a really key part of the service. So overall, I feel really lucky to have it in Barnet, and like I said, the features are fantastic and the opportunities are there. So definitely really appreciate being able to have the system.
Thank you, Caitlin. And yes, I can just echo what you have said. We also, I mean, we are now able to utilize the software in a way that it works for us as a team, and I as a manager feel really empowered. We are governing our own data, and whenever a stakeholder or a partner or a director, they want specific data, I can do this with just a few, by pushing a few buttons. So really, we are governing our data and it's always there for us. What we also have done in Merton is our data from Elementor is also analyzed by a third party, which is this CSU, Commissioning Support Group from the NHS. And we have decided to do so because, as we all know, when we all are governing our own data and we are conducting reports, you know, maybe some people think we sit and fiddle with our data or it's not correct. But we have decided to give it to a third party. And again, there was a lot of work for Elementor. Thank you, Rory, because obviously because of GDPR reasons, to download big sets of data from Elementor to send it safe to the NHS. That was quite a task for them, but we've asked kindly and they made it happen, and now it's very easy for us. And again, when we are reporting, it's always analyzed by a third party. So that's another indicator of quality, and I think that might be sometimes useful. Yes, we're very happy. Thank you very much, Rory.
Perfect. Thank you both again for sharing your experiences. I'm sure there's plenty of questions that we have burning. I'm just going to go through quickly and give a high-level overview for those of you that aren't aware of the system and the system's capabilities. With that, we'll then show you just some reports that we've taken from our demo system, and then, as I say, we'll open it up then for any questions that people do have burning. So, at a high-level overview, what Elementor is. So basically, it's an end-to-end system in which the citizen can be referred, or from the citizen's referral right through to the onward journey as well. It's a cloud-based solution, so you can work on it at any time, anywhere. It's responsive as well, which means that you can utilize it on your phone, your tablet, your laptop, or your computer. As Ben and Caitlin both mentioned, it has integrations with GP systems and also with mental health and social care systems as well, enabling express referrals directly onto the Elementor core itself, minimizing the time that it takes for those referrals to come through. What Elementor also has, which in my opinion is its biggest strength, is the detailed reporting capabilities that are within there. In addition to the report that we have that breaks down into 4 key themes around reports specifically on the client, reports around interventions, reports around programs, but also reports around referrals and cases. If you can't satisfy your information for your commissioners or funders from those particular reports, what you can also be granted access to is the data extract, which is just an entire dump of your licenses data, only something like 70 different Excel documents, where you can then start to manipulate that data and then present it to whatever funders or commissioners you require. Also, in addition to that, we've also got all our analytics products that are options as add-ons to the solution, where you can provide it to your commissioners, where they can see at a high level overview the activity that's taking place within each of their individual licenses. And in addition to the routes that we have where individuals can be referred by a healthcare professional, such as a GP or another mental health or social care professional, what they can also do is they can self-refer directly into the system as well. Caitlin touched upon it briefly as well with those functions, but it's also possible for just basically a web link to be created, which individuals can click on that web link and then request support directly. Rory, if you want to skip on the next slide. So that was more so the what around Elementor, but the why is probably more important. So why we created Elementor. So there's 5 key reasons as to why we wanted to create Elementor. So the first was around promoting better partnership working, which again, Ben and Caitlin have demonstrated through the earlier sections of the demonstration today. In addition to that, what we wanted to do was make a significant contribution to health inequalities. We'll look at how that data then presents in the next couple of slides, where how you can start to analyze not only the uptake of the interventions and services that are being prescribed, but the actual impact that that is having on the individuals. What we're looking at then as well is how we can maximize the impact of population health management, how we can also provide a co-designed pathway with patients at the centre, so making everything personalised to that individual, and then again demonstrating the impact that the VCSE organisations make. So the main focus is what we're going to look at when we look at the reports is point 1, obviously with regards to the partnership working initially, but then specifically looking at how we can reduce those health inequalities and the impact that those interventions and services that have been prescribed have had on that individual during their social prescription journey. Rory, if you want to skip to the next slide. What we can also see now in this is just basically an infographic that we release each month on who's currently utilising Elementor across our platform. So we can see that there's nearly 150,000 patients, citizens, or whatever terminology which they grant to those individuals that are being supported via Elementor's digital solution. In addition to that, we've got over 16,000 referral agents, is what we would refer to them, that are actively referring into Elementor, and that can be nurses, GPs, practice managers, housing officers, and so on and so forth. Each project is bespoke in the sense that they can have whatever referral agents they wish referring on. In addition to that, what we also have as well is just shy of 3,000 link workers or referral handlers, as we would deem, that are picking up and managing those referrals once they've been made by those various routes onto the actual projects. There's been just shy of 200,000 sessions actually engaged with or intended. There's been over 700,000 visits carried out and recorded on the system. And there's currently over 800 social prescribing hubs in which individuals can be referred onto for support that cater for a variety of needs. Rory, if you just want to skip on. As mentioned, the system as well has been adopted and rolled out across multiple different sectors, and therefore the terminology around user roles might differ slightly. We're currently supporting customers across health. We've also got customers within housing, VCSE organisations, local authorities, education. We've got employment-based organisations, and we've also been rolled out and adopted for prison care also. Just on our contract renewals as well, 95% of, if you want to just go back one, Rory. 95% of our contracts renew and our customer base has grown. We've got over 100 customers utilising Elementor across England, Ireland, Scotland and Wales, and again across multiple different sectors. And then Rory, if you just want to jump on the next slide. So back to the theme of today's session as well as such. So what we're going to evidence first and foremost is how you can monitor the uptake and engagement of those provider services. We're going to look at it from two different perspectives or two different user roles within the system. So the first view is a view that Caitlin or Ben or an individual with reporting access can access within Elementor. And this particular report is the attendance and impact report. What it tells you or what you can do is you can basically manipulate the data first of all by the time bar filter that you can see on my screenshot. With that as well, you can decide then if you want to hone on these specific programs, which is just your groups of interventions. If you want to look at the intervention attendance based on one of your particular hubs or localities, or if you just want to again look at one specific intervention. So in the example that I have, I've drilled into Hounslow Walking Football. With that as well, what you can see is basically the dates in which these interventions were scheduled to take place. You can also see the times in which those individual meetings were taking place, the venue in which that intervention took place, plus you can also see any of the hubs then that have been granted access to it. What you're able to break down then and what you can then provide directly to those providers is how many members have actually engaged in those sessions, and what those members are basically individuals that are being directly referred via Elementor. You can also capture attendance for what we deem as a non-member. So say, for example, Hounslow Walking Football, if they operate an open door policy where individuals can come on off the street, they can still record and track that attendance to get a full view of the individuals that are benefiting from their service. Alternatively, where it says is others, we capture also mass participation. So for Hounslow Football, again, or Walking Football is that example. If, say, for example, it's not a requirement for them, for their funders, they actually provide a list of individuals that have engaged, but merely just count bums on seats. In that scenario, they can also manually input a number in order to track that. What that will then tally for them is their total engagement for every session or every meeting that they have had. What you will note as well on that screenshot, just above the time bar, you will see the printable version. We can then print that out for those individual providers and provide that directly to them, for them then to provide directly to their funders or commissioners or whoever that may be. Rory, if you just want to jump on the next slide. What the providers can also do is they can access their own individual reports based on the interventions and services that they have created. So they necessarily don't need to come to Caitlin or Ben the evidence, the attendance levels that they have had. The capabilities within the system will allow them to access basic information around the attendance levels as well, around the engagement that they've had with their services. I know that the slide isn't massive in this sense, but again, we will circulate it so you can see it in a better sense. But the time bar filter, again, you can manipulate to look at different date ranges of when you've actually collated and gathered that data. Within the actual graph, the different lines that are drawn represent, again, those members, so those individuals referred directly by Elementor, those non-members, those that have just engaged potentially just rocked on off the street or whatever that may be, and also mass participation. What it also identifies at this stage is any new users, and what those new users are represented in the system is basically those individuals that have engaged in their first social prescription. What they can then see at a high level overview is the client's name, the date of birth, the amount of times that that individual has actually visited in the last 12 months, and then the days since their last visit, or if they've not yet engaged, it'll be days since their prescription. And then Rory, if you just want to jump on. One of the other reports which again starts looking at the actual outcomes of the actual interventions, is the case management report. And for those again that are familiar with the system, it's probably one of the most utilized reports within the system because it's so in depth. One of the sections within it is that you can break down the prescriptions and signpostings made to your partner organizations. What you can see is the actual link workers that have generated those prescriptions, which is displayed where it says prescribed by. So you can see in this instance, I've made 18, Jordan's made 9, Connor's made 4, and Amy has also made 4. What you can then see is, are these prescriptions still active or have they now ceased? What we can see for the prescriptions in this example, 32 of them are still active and 3 are not. We can then also look at the outcomes associated. So you can see that 28 times attendance was recorded, 3 times they attended but not returning, twice they had not yet attended, and so on and so forth. But what the actual client also has the ability to do is they can also rate those interventions and services. The ratings then associated with those interventions and services then populate your directory of services. The benefit of doing that is purely for the link worker. So if the link worker then goes on and an individual has had a really positive experience at one provider, then you're more likely going to connect a similar individual with similar needs to that same intervention or service. What you can then see at a high level overview as well is the amount of prescriptions that you've made to each of your individual partners. So you can see on the left hand side of this the interventions tab, where it breaks down basically all the interventions that are being prescribed within the past quarter, because that was the time frame that I had manipulated the data by at that stage. What you can also see in this report that's not included in the screenshot that your super users or your project leads have the ability to create bespoke is you'll also get a breakdown of the classifications and sub-classifications associated to the interventions. And as mentioned, your super users have the ability to create these intervention classifications and sub-classifications bespoke for your particular project. At that stage, you can then start to associate those classifications to the interventions and services that you create or that your providers create, and then that will populate your reports as well. So you can see the exact themes of interventions as such that these individuals are being connected with before actually drawing down into the specific interventions that individuals are then being directed to. And then Rory, if you just want to jump on. So the next one then is how you can actually start to look at the impact that these interventions and services are having, or just in general, the impact that your social prescription project is having on the individual. So what we can see at this stage is we can see 5 participants. What I've manipulated this particular report by is the fact that their cases have been closed. And again, it's all dummy data. What you'll see on this particular report is the individual's name, their date of birth and their current age. You'll also see the date in which they were registered. You'll see the reasons for referral and their case status. You'll see when they were created and by who. The actual owner or the link worker that then managed and supported them during their time with your project. And you'll also then see the amount of appointments that your link workers have engaged with those particular clients, the amount of case note entries that they've inputted, but also the actual social prescriptions that they have generated. What you'll also see with those social prescriptions is the attendance that has been tracked and any ratings that are being provided for those interventions. If individuals such as Natasha at the bottom of my screenshot has been prescribed in the multiple interventions, then at that stage they will tally up the total attendance across both of those interventions. In the example then, what we've done is we have filtered the report to also include the SwimWeb's health journey. And what that will then display for the individuals, it will display the individual's most recent score, the individual's initial score whenever they started with the project, plus the date in which that was recorded, and their most recent score, as well as the date in which it was recorded. What's useful in particular about this report is that you can manipulate it by a host of filterable options on the left-hand side. And then you can produce a download of your filterable options as well. So if you want to draw into a particular demographic of a client, you can do that before then looking at the particular download. Or say, for example, if you're reporting back to a particular practice manager on the journey of the individuals associated to their practice since being prescribed on, you can manipulate the data by client GP practice and then download that report and send it directly across. And then Rory, if you just want to jump on to the next slide. Okay, so what we're going to do now is we're going to open it up for a Q&A. If you just want to pop your hand up if you've got a question, we'll give you the opportunity then to unmute yourself and ask away. Other than that, again, you can continue to use the chat box. Rory is monitoring it, so if there are any questions on there, Rory can let us know, and we'll read those out as well. So if you've any questions, if you just want to pop your hand up. Don't be shy. have we any? Oh, we've got a hand. Lisa, do you want to shout out if you want to unmute yourself?
Hello, how are you? Thank you so much for this very informative webinar. I am social prescribing coordinator in Dublin, running, a very small pilot, I suppose, being really at this stage where we had set up the program and we'd linked in with our referrers, linked in with our GPs, and I suppose we're not using these functions yet, I suppose, in the way that you're describing them there. And I suppose one reason is that we wouldn't have the capacity in the small project at the minute to work that way. And I was just wanting to maybe hear, just out of interest, kind of, what sort of support, the size of the team, you're talking about in terms of populating it, because we are kind of in a situation where I suppose at the minute we're mapping ourselves into it based on our community asset map, and we can see all the functionality, but we know the capacity that will be needed to kind of bring it full circle. When you're in a very small program, I suppose it's really useful for us to see what it can do, to make a case as well for funding. But I'm just interested in hearing kind of how other people are using it at this stage, because when you're at this early stage, as I said, you can get your community providers on board and everything, but to actually track the attendance in every activity and everything, it actually does take admin time as well. So I was just interested in hearing about that.
I can chip in and answer some points of that question as well. Lisa, is there anything Ben or Caitlin that you want to add about your experiences first, or would you like me to answer?
You can start, Rory, if you want. Yes, sure.
No worries. So what I advise and experience from working with different projects is, if you do have some providers that are interested in taking those steps and coming on board, what I would say is start small and let it grow organically then. So, have almost like a pilot or a trial period, something like Caitlin is currently doing with some of her providers that have been engaging over the past couple of months with Barnet at present. And again, we just started small, spoke with a couple of providers that were interested, give them the opportunity then to benefit of the training, utilize the system, and then grow from there and get feedback from them of what went well, what can we improve, and so on and so forth. So my best advice would be to start small with those that you are currently communicating with, grant them access to the system, and then just make sure that they're happy with it, and then any feedback that they have, again, can come through the same support and avenues as what you have as well, so you can just feed back under the team any suggestions that they have.
Okay, that's really great, and actually it is what we are kind of planning to do, because we felt that we needed to build a credible service and work towards having actually sustainable funding and trust by our referrers, I suppose, into our expertise, and working with obviously our community partners. That's absolutely fair, but they also needed to see, first of all, that there are actually credible referrals coming from our program before they would actually have the time and potentially take the time to come on board and put their activities on the system, when in fact, let's say if they only receive one referral a month from us, it's not worth their time. So we had made that strategic decision at the time to kind of just leave that to later, and we're at exactly that point that you're describing now, where maybe we might identify our 10 kind of main groups that we refer to, and that could be a good way of doing it. But thank you for that. That's great.
No problem at all, Lisa.
I'll just add one thing as well. Sorry, just on that, I think it is really important to take your time with each of the steps, because as well as that, it is, as in management or coordinating it, is kind of like you're excited about the next day, but actually remembering that the social prescribers are the ones that are having to do all of this. So you need to take them with you, and I think it is important to sort of layer it almost. And so we're at that stage now where some of our team are logging the attendance, but it's mainly just coming from the conversations they're having in their follow-up. So how did you find that? Did you go to that session? How was it? How would you rate it out of 5? And they're able to add that in. And it's only now that they've just started doing that, and we've had it for 2 years. So I think it's important to take your time with it as well.
And actually, sorry, I see that somebody else has their hand up, but I just want to add to that in Ireland, we're actually at this stage here where a lot of us are coordinating and caseworking as well. So I actually do the casework and coordinate and make all of these decisions. So this is literally all in one person. And I have a team member who is a caseworker, but we're very, very small at this stage. So it is very much about capacity, and you can see the scope that is possible, but you're just not able to do it all. So it's really good what you're saying there, because you just need to bide your time.
Perfect. And Deirdre, do you have a question? I see your hand up as well. Oh, you're on mute.
Thanks very much for the presentation, and to Ben and Caitlin. I had a question for them. It kind of relates to what Lisa said. I'm in Ireland as well, and it's just myself. And I'm just, what I'm gathering is you have admin support for inputting information. Do you on the system? That's the first question, because the system is as good as what we put into it, I suppose, to be able to generate the reports. So that was one question. And the second question, I was interested to know how you said you use the reports to highlight waiting lists. I'm just wondering, is that when you just see that you have X amount waiting to be registered on the system, or do you actually, is that when you just see the numbers, or do you actually create a report from that? I just wasn't familiar with that feature, that you could create a report of waiting lists. So how do you use that? They were my two questions. Thanks.
Does anyone want to take the lead on the first question? I don't mind doing the one on the reports.
Can you remind me on the first question, please?
It was about the admin. Do you do your own? I understand you're managing a team of social prescribers. So is there an expectation that the social prescribers would do all the filling in of the attendance and that, or do you have somebody else, or do you do it yourselves, for example? As
the whole team. I mean, when they see patients, obviously they have to put all the data onto the system. Usually it's just to push a few buttons, but if you see 10 patients a day, it's a bit of a task. And that's why every day our team, they have like an hour for admin tasks every day, and they don't see patients. And our link workers, they only see patients 4 days a week. 1 day is only for admin, and it's just not for admin. It's about going out in the community, having contact with patients, and with voluntary organizations. We thought it's not healthy that people see 10 patients or 15 patients 5 days a week. So that's our answer to this. So they have a lot of time for their admin work, and it is a lot. Not just for elemental admin, but they also have to deal with the EMIS software, as I mentioned. Another practice is they're using another service called Vision. So, and then we have our own software system. So yes, they have to put everything onto the system. Initially, it takes a little while to get their head around it, but they just upload their part in terms of how often did they see them, reason for referrals, where did they prescribe their patients, what services they prescribe them to. But then the voluntary organizations, some of them came forward, and they're now using this as attendance lists, and they do that part of the data. And it's worthwhile because we haven't spoken about the well-being scores. You know, we're using ONS4 before we were using PAM. And, you know, it's all nice to talk about impact, but what data did we had before Elemental to really underpin that? And because ONS4 or PAM or other well-being tools are implemented within the software, it's very interesting for a lot of organizations, not to speak anecdotally about impact, but to show you data, how somebody have felt half a year ago when they came to the service and how they're feeling now. Mostly it's progress, but we're all human beings. Sometimes we record regress as well. But yes, so that's, I think, the main thing to get people motivated. It's about the patients, it's about their well-being, and we have to document this, and it takes a bit of admin time, yes.
Yeah, definitely. But we in Barnet, when we were uploading the services, sort of updating our intervention lists, I primarily do that, so I'm a full-time manager for the service, but we actually had our project manager from Elementor really support the starting process of that, because we just had a massive Excel document essentially and was just like, right, let's just put this onto Elementor. So we had a lot of support from our project manager and Elementor helping with the kind of actual admin. But now on the team, we've created a small group, sort of a intervention group from our social prescribers, where I meet with them every 2 months, and we just go through the intervention list and the service locator, just updating any new information and sort of that side of the admin. But same as Ben, you know, we make sure that there's clear admin slots in the social prescribers diary to sort of, you know, manage referrals, manage Elementor case notes, and also EMIS case notes, as we use EMIS in Barnet as well. So they don't have a full day, but they have sort of a scheduled hour admin throughout the day or at the end of the week. So that's how we sort of manage that as well.
Perfect. And on the report query as well too, Deirdre, one of the ways that a lot of projects are doing it in order for it to be evidenced in reports easily is the same way that you would create an intervention. So say, for example, you as a link worker are meeting with clients, and clients are continuously bringing up, say, for example, yoga, that they wish to engage in a yoga session or whatever that may be, but currently within your locality, yoga isn't provided as one of those provisions. What you could then do is create an intervention on Elementor called No Yoga. The same way that you would prescribe a participant to an actual intervention that takes place, you can then prescribe any individual that expresses that intervention to that yoga. Whenever you then go back to your funders or your commissioners, you can then evidence to say in the last 3 months alone, we've had 20 participants within our locality express an interest in engaging in this type of service, but we currently don't have funding available for it. Is there a way that we can get funding in order to satisfy this need? So that's one way that a lot of projects are doing it. There's other developments that have been released now around the structure of how an actual intervention is created, the likes of by appointment, where you can put a strict capacity on it. So if you see that that capacity is being met basically on a weekly or monthly basis, then at that stage, then it's about going back and saying, okay, can we extend the capacity to provide basically additional sessions here, because this is oversubscribed every single week or every single meeting. So there's different ways in which you can do that.
And may I just also add, to be honest to ourselves, like IT is really not my strong suit. I mean, I'm not IT illiterate, but it's very basic, to be quite honest. I just know what I need to know. It's not really, I'm not really interested, to be quite honest, but obviously I need it for work. But within our team of 11, 2-3 people are really interested, and they know parts of Elementor way better than I do. And that's fine for me to admit as a manager. I don't need to know all of the things they need to know. And there are 2-3 people within our team who are really leading, and they're enjoying it, and they're really digging deep in the software. So I think it's good to have that honest conversation within the team, who would like to have a go. And maybe, initially we said to those 2-3 people, you don't need to write the team minutes for 3-4 months because you're busy with Elementor. But they took a lead on implementing it. And also there's one colleague, she got the right relationship to the providers, and she can identify when an organization could benefit from Elementor. And she always have those sort of conversations. So I really do think it's down to the skill set of the team as well.
Thank you.
Brilliant, Ben. Laura, is it? I think I see a hand up.
Yeah. It was just really to Caitlin and Ben. Do you do any quality assurance on the groups that you have registered within Elementor? Is there any check-in before you register them with yourselves?
Yes, we have to comply with the social prescribing quality assurance framework. So every organization that we put on the system, and all of our colleagues, we put organizations on the system, but before that they have to send that organization to me, and I have to check mostly the bare minimum of insurance, safeguarding training, health and safety, depending on the activity. But we always have a tick box kind of set of questions, and they have to provide us with proof. And we do not take on commercial companies. It has to be at least a social enterprise or a charity. We're not there for profit at this stage. So that's what we do.
Brilliant. Thanks, Ben. Thank you.
Rory, I think he's just messaged to say that there is one more question in the chat. So around how many patients does each social prescriber have on their caseload? I'm assuming that's going to be different for each of the individual projects, but do you want to give an indication as to what the link workers would currently manage?
Yeah, we actually have a London regional coordinator for social prescribing, and she sort of filtered down some of the framework from NHS England. So we use that, which basically says 250 to 300 cases per year. So we use that as a benchmark, and actually that's a really good tool to use if you're discussing with primary care network or CDs about actually social prescribers' capacity. So we sort of use that as a bit of a way in to suggest that they need to hire a new social prescriber if that link work is doing well above 300. So that's a really sort of our main measure.
Yeah, but also since since the beginning of the pandemic, the whole kind of industry has changed, because we only deliver at the moment for the last 2 years, maybe around 10% of our consultations are face-to-face. The rest are telephone consultations. So before the pandemic, we were only able to see 5, 6, 7 patients a day. And now, because of telephone consultations and the rapid change of the need of the patients, it's more dynamic, and we can see way more people or consult way more people. Having said that, as you know, when it's a complex case, or you have 2 or 3 of them, where you need to speak to a child of the patient, or there are language barriers, or you have to speak to other agencies, sometimes you may just see 3 patients a day and you were quite busy. But sometimes you might be able to see 10 because it's all over the phone. So even though there's guidance out there, and it's good to have that in mind, at least for us, our experience is quite different in terms of numbers and what people are capable of delivering online or over the phone.
Perfect. I know we're approaching closing, or basically the end of the scheduled time. What I'd just like to say first and foremost, a massive thanks to both Ben and Caitlin for giving us their time today, and they talk about their experiences with this. I'm sure it's been very, very useful for everyone on the call. If you would like additional information on anything to do with Elementor, there's a contact currently on the screen. If you want to contact Gail at elementalsoftware.co, or for those that are already utilizing the system, if you want additional information, you can reach out to your customer success executive, and they'll be happy to support you with any of these changes or any questions that you might have that stem from this. So, and again, thank you all for attending. It's been a pleasure. Hopefully you found it beneficial.